My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one. First of all, you have to remember that if you're seeing photos of people in magazines that they have airbrush artists, makeup artists, there's lots of techniques for making somebody's facial features in a magazine look a certain way. Also, the thickness of a person's skin often determines how refined or how defined the nasal tip can be. So in our patients who have fairly thick skin, I'm pretty honest with them. It's not possible to get your nose to be as pointy or as defined as somebody who has thin skin. So I think you have to have a pretty realistic expectation of what your results can be depending on how thick your skin is. So no, the answer is you can't really have whatever tip you want. But I always encourage people to bring photos of noses that they like. Even if I can't give them the exact look, it at least gives me a sense for what their aesthetic goals are. And I can at least try and get towards that if possible. Yeah, I think there's lots of people who generally like their nose. They like it on profile, they like it on the 3/4 view, but they sometimes feel that their tip is a bit bulbous. As I said in previous posts, the roundness of the tip often is related to the size of the underlying cartilages, the consistency of those cartilages, and also the thickness of the skin. So there's only so much you can really do with rhinoplasty. I think in a patient who's got really thick skin, but kind of flimsy, soft cartilages underneath, there's not a lot you can really do with that. So I think there are patients that really just want to refine or narrow the tip, but that is quite complicated. Although it can be done, in most cases, the thickness of the skin is going to limit the final result, and there's nothing that you can really do about that surgically. So I'm very cautious with patients who just have tip refinement as their only request surgically, as I think the degree of improvement from a rhinoplasty with just making the tip better can be fairly small. It's not that the surgery itself is difficult, it's just very hard to know how thick, how flimsy somebody's cartilages really are until you get in there. And if someone's got very, very thin cartilages and very, very thick skin, it doesn't matter what you do to those cartilages, you put the thick skin over top and it's just going to look the same. So I think it's difficult to predict if you're going to get the result that patients have in their mind. And I think that's the hard part, is trying to understand what somebody has as a goal and trying to communicate to them what the limitations of the surgery are and make them realize and understand, the degree of change that they're going to have. It's often fairly subtle, and I think that unless there are other changes, for example, on a profile view with a large hump, or if the tip is tilting down, those are things you really can change with rhinoplasty. And unless a tip refinement is combined with some of those other problems, I think it's hard to make the argument that someone should have surgery just to make the tips, slightly narrower. Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.